Då välkomnar vi Per Hedin, för han är vd på SensoDetect som kommer att presentera här alldeles strax. Hur är läget, Per-Anders?
Det är bara bra, det är toppen.
Härligt. Jag ska låta dig presentera, så kommer jag strax att komma tillbaka för att ställa ett par frågor.
Toppen, tack så mycket. I will do this presentation in English. Hope that's okay. The questions would be in Swedish or English. I can do it both. So I'm PA Hedin. I'm the CEO of SensoDetect. Don't you think that the brain is amazing? Your brain contains about 100 billion microscopic cells called neurons. So many would take you over approximately 3,000 years to count them all if you would start now. Whenever you dream, laugh, think, see, move, breathe, or in our case here, it's because those tiny chemicals and electrical signals are racing between these neurons along billions of tiny neuron highways. So the brain is simply amazing. It's quite complex as well. It's made up of three main regions: the cerebellum, and the brainstem. And it is the brainstem that is the focus of this company. Because one of these highways, our brainstem auditory pathway, is located at the base and the center of the brain in the picture on the left. And based on more than 30 years of research at Lund University, we have at SensoDetect created a way to measure these tiny electrical signals reaction to sound and match it to different diagnoses. We simply follow the electrical signals all the way from the inner ear through the brainstem and at its end station, cerebrum's temporal lobe. What you can see on the right-hand side of the picture is how we actually measure them. So as these neurons are firing away and through the auditory pathway, up the brainstem and to the midbrain, they emit tiny signals. These are then translated into what we call an ABR curve, and can differentiate between a diagnosed person and a non-diagnosed person. These are variations in amplitudes, in interval peaks, and the latency, to mention a few of them. I think this slide we've seen before and heard in the news. This is taken from the EU Council on Mental Health on the 13th of November this year. It shows that we have a very large increase in the growth of anxiety and depression, with 25% in the first year of the pandemic. We have a 22% increase in loneliness in the EU after COVID-19, meaning that it's continuing. And a staggering 49% of the young people, adults 23, don't have access to mental health support. They don't believe they have that. They don't believe they have the support and the understanding of the community or in the medical profession. Before the pandemic, 1 in 6 had mental health problems. And although I believe strongly that will be more like in 2 or 3 in today, what we do know is that 1 in 2, that means 50% of people felt depressed or anxious in the last 12 months as of June 2023. Depression and different functional disabilities have been in the focus for the media for the last years. These are, of course, due to a lot of different factors, and I will not go into those factors. I have my personal theories, but those maybe I can leave for comments later. However, I find it extremely interesting that psychiatrists are virtually the only medical specialists that never look at the organ they treat. I mean, if you think about it, if you have a chest pain, you go to a cardiologist. They do blood work, they do the measurement of the pulse, they do blood flow analysis. You go and you think you have pain in your leg, and the orthopedics will, of course, do an X-ray. Psychiatrists, however, don't have the correct tools and enough effective tools to do the same that the cardiologists and the orthopedics do. And I think that has to change. Now, there are many reasons why that has to change. One of them is, of course, that over time, it's hard to compare the treatment methods, but it's also hard to compare one psychiatrist's view over the other view, and there's no way to compare. We offer a solution for that, and I think it's time that we use the tools that we have at our disposal today, meaning technology, meaning different measurement methods, artificial intelligence. So therefore, the mission of SensoDetect is to improve objectivity, increase efficiency, and reduce costs in mental care. To do that, we offer in 3 different areas. SensoDetect Diagnostics, we offer an easy-to-use test for screening and diagnosing different mental conditions. We offer in SensoDetect Health an easy-to-use objective hearing screening test. We offer an easy-to-use 100% objective test to measure the medication's effect on the patient so that we can select the right medication and the correct dosage. I will leave you with a short video presentation before I move on and talk a little bit further on these pressing issues.
Introducing SensoDetect Bira, fast, easy to use, and fully objective tool for detecting mental illness. Based on more than 30 years of extensive research in clinical psychoacoustics at the Department of Neuroscience at Lund University, we deliver a safe and diagnostic aid that has a sensitivity and specificity of almost 90%. Within psychiatric care, SensoDetect Bira improves both diagnosis and treatment efficiency to not only reduce hospitalization costs, but also foremost to improve the quality of life for patients and their families. The technology, brainstem evoked response audiometry, works by stimulating the patient with sound and measuring their brainstem response. The patient's elicited waveform response is measured by surface electrodes at the forehead and mastoideus and is characterized, among others, by the relation between amplitudes and latencies of specific peaks. All patient test data is sent to SensoDetect for brainstem analysis and translated into an audiogram with curves called Auditory Brainstem Response, ABR. The ABR is then compared to a healthy population and to different diagnosed groups such as ADHD, autism, and schizophrenia, where discrepancies in the ABR curve can be related to each of the different diagnoses. Finally, the audiograms are reviewed by a healthcare professional and used as an unbiased support for diagnostic observations.
So now I hope that you have a better understanding of what that we're actually doing. Just a quick summary of it. Basically what we do is we ask a patient to listen to specific sounds through headphones. We record those reactions that the brainstem has through electrodes, 2 behind the ear and the mastoid bone, 2 in the front of the forehead, and then control so to see that we are measuring the right thing in the arm. Those then are translated into different biomarkers that are specific for different diagnosed groups. And through one test that takes about 14 to 15 minutes, we can say with a percentage certainty that your brainstem is the same brainstem as the different diagnosed groups. Meaning, for example, 75% comparison to the diagnosed group of, for instance, ADHD or autism or schizophrenia or depression and so on. It's important to say here that this is not an absolute science as of yet. Maybe in the future it could be, but we are a very good tool for screening and diagnostic support. The different areas that we are in are the medication, diagnosis, and health. Currently, we are offering our services to ADHD, autism, and schizophrenia when it comes to medication. And I'll go through a little bit more about medication in a while. We are also offering SensoDetect diagnosis, ADHD, schizophrenia, and autism. And we're looking into the areas of depression and cognitive plasticity. Cognitive plasticity is, for instance, very important if you are subject of an accident or get a stroke. That is the brain's way of reformatting itself and shaping it through the new neural pathways. And then we have, of course, SensoDetect Health, which is the basis of this technology, hearing test. So the ABR technology was invented in the 70s and has been used since then to measure on small children or newborns. So by that also you understand that this test is 100% safe, because otherwise we wouldn't use it on children, especially newborns. So when can you use our methods? Well, I will take an example of ADHD. So usually you get first contact in some form. That is usually a worried parent for the child has learning problems in school, for instance. Here it is a perfect tool to screen and say, well, what could this be, the cause of this be? So then you do a 50-minute test, and we can concur that the brainstem has the same functionality of those of a specific diagnosed group. You can also use it as an unbiased support in confirmation of a diagnosis, together with all the rating scales, the medical examination, the questionnaires, and the checklists that are mandatory today. When the patient has gotten a diagnosis, we can also now, thanks to new research and recently published material, set the baseline of how your brainstem specifically works. And based on that, when doing the medication, we can see if the medication has taken the desired effect and then control and adjust it. We can also, in the medication part, of course, look into research together with pharmaceutical companies, which is very interesting in the part of developing new drugs, validating which drug is the best drug, and so forth. Then, of course, you have the yearly follow-ups, the second opinion, where you can also use our service. In summary, as I said before, using all these technologies, where one is ours, you can get a faster and more cost-efficient service, and foremost, actually increasing the patient security. You remember that I said in the beginning that it's interesting that psychiatrists are virtually the only medical specialist that never look at the organ they treat. Now there's a reason why most psychiatric medication have a black box warning. So before you have these other methods, the best a psychiatrist could do was do a qualified guess. I'm not saying that they did a bad work. I'm not saying that they do a bad work. They're excellent at their work. But with this new tool, you can be more precise. And the limit the guesswork, so to speak, and actually measure the effect of the drug. Now, this is a big problem because not only in the setting of the diagnosis, but when you give a medicine, for example, an ADHD medicine to a person that has autism, that is complete disaster, and you can actually provoke new mental problems by giving the wrong drug in the wrong dosage. Also, for the patient, this is a problem because if they don't get the right medication, of course, that would be a catastrophe. But also in the dosage of this, because it causes enormous suffering for the patient. We can also with this method actually then help set the right dosage. So SensoDetect, our global presence. We are currently in Saudi Arabia, in the Middle East, GCC countries. We are currently in China, and we are currently in Bolivia and South America. The wanted positions are, of course, looking forward is, of course, to do an FDA application, but I will go through that in the coming slides here quickly. In the GCC, we have an extremely promising collaboration and with Arabian Trade House, formidable distributor, and also with Dr. Saleh at the University Hospital. Now, we want to do a study on autism, which at the end would mean that we are the only exclusive delivery partner of the mandatory hearing and screening test that the Saudi government has set forth. Now, we will not wait for the result of that study, of course, but we're using Dr. Saleh as an ambassador and the medical advisor. We will approach the clinics, set forth the marketing campaign that is already in place, and begin with Saudi. And then we will expand out to UAE and Qatar, and then going forwards there. We also have a very interesting project when it comes to the schools and their mandatory hearing screening. In Asia, we're focusing on China. We have a collaboration with a distributor today called Ensheng. We have a new collaboration with a very promising doctor in Dr. Liu. He's one of the best neurosurgeons in China. We will continue to do the application and develop together with a joint venture with the new interests people in the investment sum up to 100 million they're wanting to invest, and then of course look into new areas and do clinical research there. But foremost, we are looking to get out in the market. First, we need the NMPA's approval. In Americas, we have a collaboration with the distributor called Isis Medical. We also have the dean of a prominent university there, Schulmeier. We will then, in that area, continue with the clinics that we already have started with, expanding into Mexico. But foremost, we have a very interesting, promising negotiation in doing screening tests for children when they start school. I think I'm running out of time, but I will just quickly go through the numbers. What I want to say with this is that yes, in every company that is looking forward and expanding, of course, these numbers can be bloated up and taken to a height that is not realistic. But just to mention, if we, for instance, go into Saudi Arabia, just adding autism, and autism has 1% of the population, and if you have only a market share of 0.1%, that would mean that we can do with 4 of our devices. We have a yearly turnover of 57,000 euro. If you increase that, for instance, upping up to 2%, then you have a 572,000 euro for 27 devices. Now, the cost of one device is 1,200 euro. It would last for 5 years. So the total cost to earn those 57,000 euros, it is 24,000 euro. So as you can see, 2,004. So you can see there is adding the devices, there's an extremely high return on investment. I think I will leave it at that and maybe answer some questions.
Yes. Thank you very much, Per-Anders. I thought I could begin with China. You mentioned that before commercialization can begin, you need the approval. So I have one question here from the chat. When do you think that approval may come for the product?
I'm hopeful that they will come in the Q2 now in the NMPA. What we have had is a very good and close collaboration with the authorities. And they have given us the heads up on what we need to do and what we need to improve. In China, you get one try, one go, and then you get back in the queue again. And this has been prolonged for a long time now because of the COVID and other issues. So definitely in Q2.
And with your partner that you're starting a joint venture with, what is the purpose of the joint venture? Could you elaborate on that?
Those are... The starting point for that discussion was the treatment of and the effects of stroke. So that's the brain plasticity. So the main focus is that and the hearing and to research together. Because in China, it's extremely important that it is seen as it is invented in China. That will also make it faster to go through the authorities, the approvals. The second part is, of course, to have a strong collaboration partner that has a strong connection to the hospitals and the proper authorities. So that's the second part.
There is one user in the chat that claims that you were in China at the beginning of November and is curious on how the trip went, so to speak. Could you elaborate?
Yeah. The main event was to present in front of the best neurosurgeons in China, and this is a society and a membership that is awarded. It was an extreme honor to be there to present to these prestigious people. It went very well. We have had a lot of inquiries on people who want to buy the service from us. So once we get approved, I think this event will have a fast track into the hospitals. And the other part, we went and signed an agreement with in Taiden with the authorities in that region, together with the Haijing medical devices. This will mean that we will not only have the financial powers, meaning up to 100 million to invest in that joint venture, but we will also have the right connections with the proper authorities in China to fast track this solution into a more of a permanent mandatory screening tool.
And what short and long-term goals do you have in the Chinese market?
So the short-term goal is to get it approved by NMPA. The long-term goal is to establish us as a mandatory test, beginning with the schools for when the children start school, to have a mandatory test for that. And the long-term goal is exactly the same as in Saudi Arabia, actually, because once we get the positive feedback on that study, we will be the only one in the world who can offer a screening for autism for children under 4 years old, together with a hearing test.
Closer to home then, one viewer asked the following in the chat: how is the interest for your product here in Sweden?
That's an interesting question. The interest is high. However, in Sweden we have a system that is not really built up for catering for new innovations when it comes to in medical technology. That in combination with the the limited amount of people and that we can distribute this to from a profitable way have meant that we have, of course, continued our interests here in Sweden, and we have collaborators today, but comparing that to 1.5 billion people in China or in the Middle East, that is an easy choice for SensoDetect right now.
I also want you to elaborate a little bit on the business model for the BERA unit. What sort of how do you say income sources are available there?
Okay, so it's a software as a service. That's the basis. We set the contract for a delivery of one machine. They will pay for that machine, which they then can refund. It's refundable money. Then we set up a contract of minimum amount of measurements per machine. So if they cannot withhold that one, then we take back the machine and we put it in a central place where the measurement can be done. And then we charge for each time they do a measurement. So depending on the country and the amounts of measurement of those contracts vary. But in China, for instance, we're going for a more high volume, low cost. But if we compare to, for instance, UAE, then we're going for a more high cost, low volume. So, but the prices are that we get through that is at least 50 euro per measurement, generally speaking.
Does that mean predictability in revenues when commercialization begins?
Yes, because each country has a specific target. So, for instance, as I said, a high volume, low cost. Then we know we negotiate the prices beforehand, of course, and then the predictability is quite high. It will vary if we have offers, of course, but those will be for a limited time and for a limited number.
Could you speak a little bit about your plans on furthering developing the product, as well as telling us a little bit about what the challenges are to continuing to develop?
What we need, in general speaking, we are now doing a new emission because we need to be able to expand the organization, to actually cater for the big promising company that we are. In that sense, we also need to cater for the production costs, of course. The challenges, I would say like this. I get constantly surprised by each area we enter into, how potent and exact this measurement technique is. The challenges are, of course, to fast-track clinical investigation, which usually takes years and years, and find ways to mitigate that.
Can you comment? There's a viewer here, and I'll have this as the final question. The current time plan for the sort of announcement in Saudi concerning autism and China for joint venture, are they currently active, or what is the current time plan there?
Yeah, so this is one of the big things in medical technology and pharma, I would say, is patience. I'm more of a fast mover and I want to get the results quickly. However, I have to realize that the medical and the hospitals, they don't move as fast as I want them to do. In Saudi Arabia, I was hoping to do the announcement today, but I think it will be postponed about a week, and then I will make the announcement in the autumn study and the collaboration that is looking forward. So that's big news to be waiting for. And then in China, the joint venture will be after the new year in Sweden.
Per-Anders Hedin, thank you very much for being here, presenting and answering our questions.
Thank you for having me.